of the things that we need to be able to do is have full extension at that wrist joint. Mobility WOD Daily Perform videos, Dr. Sean McBride here. We're going after the wrist extension today. We're gonna need a Leopard claw, some other scraping tool, or just a butter knife out of your closet. If you want some sort of emolument, some sort of solution, if you have some lotion, even just some coconut oil will work for that. This will be part 2, so we'll come back to this in a moment. Other tools you'll need today: band, box, simple. So here's what we're looking at. In a press, like a push-up, one of the things that we need to be able to do is have full extension at that wrist joint. If we are lacking the ability for the elbow to travel over the wrist, that may look like an elbow fault, but really you're just going around that brick wall right here at the elbow. Okay, so what we're gonna do, we're gonna grab this band, we're gonna get a pretty good amount of tension on it. Band is going to go right across the top half of this wrist joint line, and your hand right here, this thenar grip, is going to come across this side of the joint line. And what we're going to do is create a little distraction at the wrist joint. So I'm pinning down here, I'm pulling away. That's going to help clear any impingement I have across that joint side. So if you get pain in the back half of your wrist here, across here, anywhere, you really want to apply a little pressure across that spot. We're not looking to pinch the back side of this joint. We want to feel, if anything, just a little stretch here on the flexor side of that wrist. So we're going to take a good dozen, maybe 20 passes across this joint line, and I'm working various different angles here. If I ever run into a little pinch, say I feel a little pinch across that outside, I'm just gonna pull across, create a little extra tension, and I'm gonna try and continue. And our normal is 90 degrees of loaded wrist extension. If we can steal an extra 5-10 degrees, that just gives you a little breathing room so you're not running into a brick wall right at the top of your push-up. Helps us get maybe a little extra if we need some handstand push-ups or some planche push-ups. So, other ways we can hit this, if you don't want as complicated of a setup, we can also be doing this down on the floor. Same idea, I just need to be kind of kneeling down here, and I'm hitting that joint side there. I can also start to play with this position a little bit and put myself into this position while, say, I do a little reverse grip push-up. Lower this band down. And this is actually the movement that got me thinking about this today. Being able to maybe run through a little reverse grip push-up. This feels so much better on this left side than my right side now that I've mobilized it. Now, one of the other things that can sometimes limit, if we're really tight, you got that desk forearm, maybe you're someone who works with your hands a lot, you use a lot of fine motor grip here, these muscles may be incredibly tight, and that can also limit your ability to extend across that. So, really simply what we're gonna be working on here, just a little scraping work. And grab a little, just a dab, just to get a little slide across those tissues. And I'm just gonna start with just a little general work, really working towards this medial epicondyle here. I'm gonna stay off of the bone. I'm just gonna start with some general work, feel if there's any crunchiness in here. And what I can do to make this very specific to the position is then I can put myself into the position of restriction and I'm running along those tissues. So I'm not trying to go super deep here, I'm just going with the direction of the tissues. This is pretty intense. So I'm just going at the depth I can tolerate. You can see some areas are already starting to get a little red. I'm not going to keep treating those areas. I don't want to over treat these tissues. And just for a little elbow health, I'm gonna finish with a little scraping work in the opposite direction. Just make sure I get that full treatment effect. This might only be 20 or 30 seconds till I'm all the way red. All right, a little wrist extension work for you today.